Is there something special about an artist's brain? Is artistry a specific talent given at birth? Or can actually every person be an artist? We might be able to answer these questions with the help of people with neurodegenerative diseases. In our understanding, we have to look at the two main points: the artistic skills and the artistic mindset. When people say that they can't ever be an artist, they usually mean that they lack the respective skills, even though a skill, just like any craft, is usually attainable by a lot of practice and training. There has already been a lot of research. The skill of being an artist is not based on one specific brain area, but on a coordination of different networks. And these networks communicate through neuromodulators. Neuromodulators, for example dopamine or hormones, are chemical messengers in our body. Their levels can be observed and measured. Although this method is common today, it's very new to art research. We can use the knowledge from other fields and combine it with our knowledge of art research to get a better grasp on how the artistic brain works. We took a similar but different approach by asking what happens when the brain network doesn't work properly due to diseases like Parkinson's. Does that change the engagement with creative activities? It just might, and here is why. People with Parkinson's disease have a loss of one specific neuromodulator, dopamine. We assume that dopamine is very important for being able to be artistic, for having the motivation to do something creative and to learn. And although people with Parkinson's lack this neuromodulator, a study has shown that about a third notice a substantial change in their creative productions, or even start being creative for the first time in their lives. While external factors like occupation, relationships, and motivational support or therapy certainly do play a role in developing artistic skills, one major hypothesis is that the drug used for treating Parkinson's, which raises the brain's dopamine levels, leads to the phenomenon that the ones who try find their inner creativity. This is why we want and need further research. We know that creativity needs motivation and an open mindset. Maybe the unusual circumstances of people with Parkinson's are creating new opportunities to be artistic. If this is true, then everyone can be creative. While developing the skill is based on practice, starting the training is based on personal motivation and an open mind to new experiences. Factors that you yourself can stimulate, neurochemically speaking. Further research would not only be a great advance for clinical and artistic research, but also for people with all kinds of neurodegenerative diseases, and our society as a whole. This bridge between art and medicine is called neuropsychopharmacology, and aims to understand and teach how to discover your inner artist.